Hi everyone, Dr. Sylvestre here. In this video, Dr. Halling and I debunk 8 myths about osteoarthritis in the dog. There's lots of information in this video. Watch it till the end. You won't want to miss a thing. Thank you for being here. I am in Costa Rica with my good friend, Dr. Krista Halling. Krista is a board-certified surgeon and an avid traveler. She travels everywhere with her bike and her dog. And if you want to know how to do that, go to dogpacking.com because she has a lot of information for you. Today we're going to debunk the myths about osteoarthritis.
Osteoarthritis in dogs has been associated with many myths that I've heard as well, being in the exam room from pet owners, through myself. It's pretty easy to not be familiar with the science behind what osteoarthritis is, how it affects your dog, and what we can do about it. Let's tackle these myths one by one. Myth number 1, osteoarthritis in dogs is caused by old age. While it's true that older dogs can have arthritis, and maybe the frequency is a bit more than young dogs, age itself does not do it. Age does not cause arthritis in joints. As we said, it's a poor fit or some instability. And so a normal joint over time is not going to get arthritic just because the dog is old. What we can see is if there is a poor fit to begin with, if those causes of arthritis are present in the young dog, which generally is where they start because it's a developmental issue with the joint not being formed correctly, then absolutely you take that problem and you fast forward and you look at it over time. And as the dog gets older, the arthritis that starts up has time, like rust, to get worse over time. And so it might be recognized more commonly in older dogs, but it's just a factor of time that started when the dog was young, and it's not age itself that caused it. The flip side of that is that if you have healthy, normal, well-fitting joints that are nice and stable and remain stable, age alone is not going to create arthritis in you. So there are a lot of dogs that are old and are perfectly fine that don't have arthritis because they started with good, healthy joints.
And maintain them throughout their lives as good, healthy joints. Absolutely. Myth number 2, my dog has osteoarthritis, therefore I should not exercise him. That couldn't be further from the truth. The most important thing for the health of a joint is motion, is movement, weight bearing as well. The way that the cartilage cells, not that I want to get really deep into histology here, but the way that the cells that live inside that beautiful spongy cartilage, the way they get their nutrition and get rid of their metabolites is through motion in the joint. As that joint moves, it forces the fluid that bathes the cartilage into the cartilage. And as it does that, it brings with it those nutrients that the cells need. And when the fluid gets pulled out of the joint and gets pulled out of the cartilage and back into the joint, it pulls with it all the waste product from the cells. Therefore, for those cells to stay alive and healthy, the joint must move. Exercise is critical to the health of a joint. You've got to take exercise in the way it's meant to be, perhaps for that dog. So if the dog does have some poor fitting joints, some incongruence, maybe it doesn't want to go run marathons every day, but it needs to exercise. Therefore, if your dog has osteoarthritis, take it for a walk. That'll be the best thing for it. Krista, anything to add to that?
Yeah, exercise definitely is part of the mainstay. Keeping a joint, healthy joint healthy, and keeping an osteoarthritic joint healthy. And by healthy, we mean let's reduce the clinical signs of stiffness and lameness. Yeah, absolutely. Exercise will get you there. We'll discuss that in more detail as we move along. And if the way you can think of it is motion is lotion, and an unhappy joint being held still is going to be even more unhappy. Yeah. So exercise is key.
And we talked about earlier support structures being important. So if you don't exercise, the muscles are going to wither anyways, but by exercising, the muscles become healthier and more robust, and we'll be able to offer more support to the joint and a little more stability. So exercise is key.
All right, myth number 3. We have 8 of them, so we're enjoying these. Another one we hear a lot is, my dog's overweight, but that has nothing to do with its joints. And in fact, there is a huge correlation between body weight and relative body weight and how happy the joints are. So if a dog is overweight, and to be honest, most dogs, especially domestic dogs these days, are technically overweight. If they're carrying too much weight, especially if they are obese, then it can make a joint that is already struggling, that already has a little bit of arthritis, it can make those clinical signs, the difficulty getting up and around, so much worse. The converse is, studies have shown that if a dog is overweight and has arthritis, if weight can be managed and it can come down to a healthier, slimmer version of itself, that a lot of the signs of arthritis, the stiffness, the trouble getting up and around, and the lameness can be mitigated, and in some cases those can go away.
Totally.
So
Totally.
Exercise is key, and getting weight off a dog, keeping it nice and skinny, is also key to the effects of osteoarthritis, to managing that.
Those two things go hand in hand. For instance, Krista likes to keep her dog nice and lean because she carries her dog in her backpack on her back when she gets on a plane. So if her dog were fat, that backpack would be heavier and Krista would just have a lot more stress on her joints. So she has to keep her dog lean. We can
and for the dog's sake as well, of loading them up. So whether they're loaded with extra fat or they're loaded with a backpack full of supplies, that is going to create more stress for the joints, a lot more work for the joints. So keep your dog lean. Your veterinarian can help you with that, and can also help you with the assessment of that hourglass shape that a dog should be. It's so easy to get used to them being
a little more tubular.
Sausage-like, which is not a normal shape for a dog. So let's get them lean. It makes a huge difference. So there definitely is a correlation between being overweight and having difficulty with osteoarthritis.
Myth number 4, your dog has osteoarthritis. Here's some Medicam that will treat your dog's osteoarthritis. No, yes, but no. So Medicam, carprofen, Rimadyl, all of these non-steroidal anti-inflammatory drugs are fabulous for taking the inflammation down and making that dog with OA feel a lot better. But it's not a treatment for OA. It's not getting rid of the osteoarthritis. It is merely bringing that inflammation down to allow, and getting rid of the pain, and that will allow your pet to exercise more. The key is to get your pet in a comfortable place so that they will exercise more. So although the non-steroidal anti-inflammatory drugs, I'm a fan, I love them, they're great for dogs with osteoarthritis. The goal is not to use them like a vitamin and give it every day. I think of osteoarthritis as a campfire that's just down to the embers. And it's pretty safe, not much is happening, nobody's going to get burnt. But what happens as the dog goes out for a weekend warrior effect and runs around all weekend, that campfire just bursts into flames again. And what the non-steroidal anti-inflammatories will do is they'll just bring that flame back down to little embers that are always going to be there, and make the pet more comfortable and allow that pet to reestablish a good exercise format that's going to work for their joints. So love, love, love Medicam, but it's not something I just want to give all the time because this dog has osteoarthritis. And all these drugs have side effects, right? So the fewer drugs that we can have on our pets, the better. The whole goal, in my opinion, for me, my goal with managing osteoarthritis is maximum quality of life, maximum exercise that they wish to do, and minimum drugs. So that's what we're going to try to accomplish with this. Anything to add to that?
No, I fully agree, Anne. That's how I use them as well. They've got a really good role for breaking through the initial pain of, I'm stiff, I'm sore, I don't want to use my joints, I don't want to move. Now that's blocking us from starting the motion that's going to make the joints happier.
Exactly.
So let's use those as a role for pain management. Once we've broken through that and they're cruising, then just on an as-needed basis, which tends to not be every day. If we've got a good at-home program.
Program.
That's a lifestyle change. Yeah, let's do that instead of anti-inflammatories. Tends
Yeah,
to work really well.
for sure.
Myth number 5, over-exercising my dog will cause arthritis. I've heard that quite a lot. People are concerned often that they're going to run their dog's joints into the ground and have bone-on-bone contact if the dog does too much exercise. So to be clear about what we're talking about, yes, it's possible to take a person or take a dog and create problems by doing too much activity too soon, for sure. That can cause some wear and tear on body parts that are just not conditioned for that, or you surprise something and you tear it or cause injury. But arthritis is not caused by exercising. If anything, exercise actually helps keep healthy joints. That's the whole,
premise.
the theme exactly of what we've been talking about. Exercise promotes healthy joints. So running a dog or exercising it a lot is not going to cause arthritis. What can happen, so if you gradually increase the activity of your dog and get everything strong and do it in safe incremental increases, then healthy joints will stay healthy joints, and that's going to help them out. A dog that has arthritis that has been exercising a lot had that arthritis to begin with and had likely developmental issues to begin with. So basically the two can be hand in hand. You can have a joint that's not completely normal that over time develops arthritis. That same dog may also be a dog that likes to exercise a lot, but the exercise didn't cause the arthritis. It's, oh, by the way, the joints weren't developed perfectly and there's a bit of arthritis. Yeah. But I would say actually if done properly, the exercise is actually helping those arthritic joints compared to a lifestyle where the dog does not exercise.
Yeah.
So yeah, running around a whole lot is not going to cause bone-on-bone contact and wear your joints into the ground.
No, absolutely not. No. And I think the whole key as well is once you know your dog does have osteoarthritis, once it's properly diagnosed, is to find that level of exercise that's appropriate for them. And if the dog's got really bad arthritis, then maybe a 5-hour hike won't be the right thing for that dog, but the 3-hour hike might still work for now, right? And it's to find where's that edge, where's that line in the sand, and how do you know? Take your dog on that long walk, and when you come back, if he's dragging behind, he's lame later that day, after they lay down and then they get up and now they look like a really old dog, maybe that walk was too long. Let's shorten it. That's kind of how you're going to tell if it's too much. But healthy dog, healthy joint. Go running. Yep. Go fly ball. Go have fun. That's what life is about.
Exactly. And exercise is a reward for the joint.
It is.
Not a punishment. Yeah.
Myth number 6. Glucosamines are needed to treat my dog with OA. I am a fan of supplements, but items like glucosamine, chondroitin, and essential fatty acids, they're not drugs. They are nutritional supplements, and they're food particles that we all need to live. And the joints like these particles. Do they help? Yes, to a certain extent. Are they the treatment? Are they the be-all and end-all? Absolutely not. So if I'm treating a pet that does have OA, I may add these supplements as part of their management process, but I'm definitely going to look at a weight loss program, and I'm definitely going to look at good exercise regime. The chondroprotectives, as we call them, or nutraceuticals, are really, they're an additive. They can help, but they're not the be-all and end-all. I think of all of those, the essential fatty acids are probably the most important, the fish oils. What do you think, Krista?
Absolutely. Fish oils are great, and you know that because have you ever seen a lame fish?
No, but I've just heard a really lame joke.
Myth number 7. My dog's arthritis can't be treated. By being treated, if that means a cure, that's true. A dog, we can't cure it, we can't remove the arthritis and have a completely normal joint. But if we use the word treatment as a little bit more loose in that, what can we do to make the dog's quality of life and reduce the lameness, reduce the stiffness? Absolutely, there are treatment methods for that. There's a lot that can be done to help a dog get through its life with the sort of activity that it wants to do, just by modifying its lifestyle. So a lot of treatment plans. And as we've said already, the key parts, probably take-home messages, are that a lifestyle change that involves exercise and keeping your dog slim are the two big components. Some supplements can help as well, but not if you don't already have the exercise and the weight management that's happening. So there's a fair bit that can be done for arthritis to keep the dog at an excellent lifestyle and quality of life despite osteoarthritis.
Totally agree. Very, very important. There's we're so much better at managing OA, and OA is just, it's not a big deal. We can manage it, but owners have to participate. Myth number 8, my dog has OA and therefore it has to have surgery. No, your dog does not need to have surgery. So the types of surgeries that we employ to deal with osteoarthritis would be a joint replacement surgery, a total hip replacement or total elbow replacement, would be a joint removal surgery such as the femoral head ostectomy, which is probably the most common of those. Or we could fuse a joint. We kind of get rid of the joint by fusing it. And we'll do that maybe on a wrist joint or a tarsus, the ankle joint, and arthrodesis. We don't use those very often to treat osteoarthritis. I consider them more of a salvage procedure. None of the other stuff is working. This dog is still, relatively young and could have a much more life. Then maybe I'll at that point consider one of these salvage procedures. But to go and say we're going to scrape those little bone spurs out that we see on the radiographs, no, that's not going to help the dog. Very short-lived, expensive, without a positive result. It is not something that we do for osteoarthritis.
Which is a good thing. We're surgeons. We love doing surgery when there's a good reason to do it, and when there's not another reason that will probably give better results. But in this case, it's not a surgical condition. Shy of something traumatic or developmental, like a torn cruciate ligament, where the knee's going to develop arthritis because it's unstable now because of a torn cruciate ligament, that we can help out. But largely we're talking about joints that just were a poor fit, that developed poorly to begin with and now have arthritis. Almost exclusively those can do very, very well just with some lifestyle changes and non-surgical methods. So most dogs can get around perfectly fine with those little changes that don't involve surgery at all. Yeah, we make the owners work harder when it's time to managing osteoarthritis than our work, right? It's true, but the results are pretty rewarding to see just within a few days or few weeks.
You'll see
what we can do. Exactly. And a dog in motion stays in motion. You can actually look at having a more active lifestyle, not a less active lifestyle, and get out there and go dog packing with your dog. There are a lot of tools that can be used for a dog that has osteoarthritis. So hopefully this helps for those of you who are thinking, when my dog gets old, it's going to have arthritis and I won't be able to do anything with it. Or I've got an older dog that's got arthritis and I'd love to do stuff with my dog, but it has arthritis. Let's flip that around. Let's do stuff with your dog because it has arthritis. Thank you so much for being here. Krista, thank you for being here, and thank you for coming to Costa Rica and doing this with me. Again, if you want to learn how to travel with your dog in a fun, effective, and efficient way, go to dogpacking.com.